We, as a practice for sedations, we use this Triazolam and the Valium for our patients. I feel that those do limit us quite a bit with patients, just with the working on the patient understanding, the patient knowing when she or he leaves, post-op instructions and things that we need to do. We have to rely on the driver to let them know what needs to be done. I do feel that Triazolam and Valium hopefully will be a thing of the past for us, and just that way we can use a NuCalm system on most of our patients. That way we can stress to our patients the importance of post-op care, and again, not have to worry about drivers coming and making sure that they're getting home safely, and that follow-up calls to make sure everything went okay, I think will be much needed, and getting away from the Triazolam and the Valium.
I've worked on a couple patients that have had the sleep sedation, the Triazolam, and they were hard to work on. They were asleep, very asleep. And when you're very asleep, you don't want anyone bothering you. You don't want people in your mouth. You just want to be asleep. And so that was very hard to work on them. They were not very cooperative. They were asleep, so they didn't care what I was doing, but it was hard to do what I needed to get done because they were asleep. They wanted me not to be in their mouth. Versus the NuCalm, with the NuCalm, you feel like you're asleep and you're rested afterwards, but you're very helpful as a patient. It's very easy and very conducive to work in an environment like that.
On the subject of Triazolam and the Valium, we did have a patient that we did try NuCalm on before starting her treatment, just because she is very fearful, doesn't sleep for weeks before appointment. I had her come in just for a visit with me, and we did a NuCalm for 45 minutes with her. She felt that it didn't work for her, but I do feel that the stress level that she's under kind of was inhibiting anything to really work, and she was very skeptical as well. So we do use Triazolam and Valium on that patient. Her last appointment, we did wind up using 4 Triazolams. She was so basically out of it that we had to not be able to finish all the work that we needed to do that day. With that, she was not able to get up and go to the restroom as she needed, and she did, not knowing that she did it, have an accident in our chair. She was just very embarrassed of what had happened. We let her know that it was not a problem. She's called every day since she's left and just had to tell how sorry that she is that she had done that, and that she probably would like to look at NuCalm again, maybe trying the gas with the NuCalm and see if maybe that might help her a little bit more in this next treatment. That way she's kind of more aware of what's going on, and not having that embarrassment feeling leaving the office.